and this was my place to go when I needed help. And by golly, they stood next to me.
So we are a community-based health center here in Colorado Springs. We service the community and the students of Mitchell High School. Not only are we treating the students here, but their aunt, their uncle, their grandma, their mom, their dad, their sister, their cousin, all of them, they all come to see us here. So it kind of bridges the community with the high school, not just us with the high school.
We see quite a few patients that are literally within walking distance, or they drive, it's a minute or two to get here. So they're in the community. We're kind of their home base for all care.
District 11 and Peak Vista partner to provide healthcare to a healthcare desert. So this community here is what we call a healthcare desert. It has no medical care aside from us. And so the community was really suffering. They have that kind of fear of providers and the medical system as a whole, and we kind of eliminate those barriers by being that constant in their world.
It is definitely a team effort to make sure we're looking at the whole person, and not just, I'm not looking just at stress, or they're not looking just at medical. We're kind of looking and seeing how those work together.
So we have BH services here at Mitchell High School. We have family, pediatricians. We also have full service dental here. So if the patient's here to see family and they're having some concerns with their mental health, our BH provider will go in and treat them. So we really service full person, whole health here at Mitchell High School. We actually have a specific patient that comes to mind. He was actually within walking distance of our clinic, and if it weren't for us being here, he would probably have a very different outcome to his health care than he does today.
I was really scared. I didn't know what I had congestive heart failure. Yeah, very close to a stroke.
And he does not, at the time, did not have a cell phone, did not have transportation, and lived within a mile of our clinic. So he walked into the clinic hoping that his provider was in the office because he was having some chest pain, lots of kind of cardiac issues.
I have heart problems, and my medicine all of a sudden turned into a sabotage. And instead of taking water out, it would put water in, and my feet swelled so bad that I couldn't put my foot flat on the floor. So finally, after 3 days of this, it got to where I could walk, and I struggled to walk up here.
And so he walked in that day, and unfortunately we did not have his provider here that could help him. So we actually facilitated a virtual phone call for him where I called his provider, who was not in the clinic that day, and we basically facilitated a virtual telehealth visit for this patient.
Oh goodness, I don't know where I'd be without her. Oh, she says those magical words, I got you. And she did. She had me 3 or 4 times. She saved my bacon, and I mean that. And I was in a bad way.
And so we were able to, with that telehealth visit, get him in to see his cardiologist, get him back on his medication, and get him sustaining life again, and not, in the emergency room and dealing with those kind of things. So we were able to eliminate a lot of barriers that day for that particular patient.
And I heard those immortal words again. I got you. It just warms my heart with the way that they take care of you and care. They've helped me get food when I was down on, I couldn't get my food. Made sure I got my medicines. Made sure I had a doctor to see. I would recommend it to anybody that cares about getting better or finding out if there's something wrong with you before it becomes a major problem. Just God bless Peak Vista for what they do. You won't find better health care. You really won't.